We're going to look at what I call bone nomenclature, and what this is the specific parts of bone that will help you when we start to combine words that they apply to bones. Okay, so let's start with this page here. Now let me fast forward a couple slides. So we're also going to go over this and this and this. This is from your lab handout. So in my lab handout, these are listed, so we're just going to go over a lot of these are found here. Alright, let's start with tuberosity, trochanter, and tubercle. Also, ignore the highlights, so we're going to look at all of these. So just for now, please ignore the highlights. Okay, so tuberosity, trochanter, and tubercle. Really, what that is saying is small, medium, and large. Okay, now the way they have it listed here is small, large, and very large or extra large. So either way is fine, but what I want you to realize is that a tubercle is a small bump, a tuberosity is a medium-sized bump, and a trochanter is a very large bump on bone. Okay, now bumps on bone are designed for muscle attachment. Now, a muscle tapers into a tendon and attaches to bone, and they really like to attach on bumps. Okay, so just going in order here, a tuberosity is a large rounded projection, and they're showing you the tuberosity here. So this would be the tibial tuberosity, where the patellar tendon will attach. So the quadricep muscle comes down, tapers into the tendon, the patellar tendon, and attaches to the tibial tuberosity there. Okay, a crest, a narrow ridge of bone, usually prominent, like your iliac crest. So on your innominate or the os coxa, your hip bone, that crest that's on top of the ilium, it's a narrow ridge of bone. Okay, trochanter, a very large bump on bone, like our greater trochanter, which is right here on the femur. Okay, the reason why they give it the word greater is because there's a lesser. So greater trochanter, lesser trochanter. Those are muscle attachment sites. Okay, a line, narrow ridge of bone, is less prominent than a crest. Tubercle is a small rounded projection, so here's your small bump. And on your atlas bone, we have the anterior tubercle. And over here you have the adductor tubercle. So this is a site for some of your adductor muscles, like we'll get to the muscles when we get there, but there's several of them that are on the medial side of your femur bone there. This word adductor means you're adding to the midline. So we have movement, human movement, abduction or abduction, move away from the midline, and adduction, move toward the midline. So your adductors, adduction, are located on the medial side of your femur, and some of them do attach to this adductor tubercle. Bump on bone, really nice for muscle attachment. An epicondyle, raised area on or above a condyle. Epi means above, so it's a raised area on or above a condyle. So like this right here, there's your medial epicondyle, which we also have a lateral epicondyle there. Okay, a spine, sharp, slender, often pointed projection. So look at this. A spine or spinous process fits the description. Sharp, slender, often pointed projection. Okay, a process. Any bony prominence. So they'll add the word process to a variety of words like your spinous process, transverse process. Those are the wings, so to speak, on the side of your vertebra bones. And they call it the transverse process because it is oriented in the transverse plane, and it's a process because it's a bony prominence. Okay, those are found on the vertebra. Okay, the head, bony expansion carried on a narrow neck. So like the head of the femur, the head of the humerus, or the radial head. So any bony expansion. Okay, a facet. Smooth, nearly flat, articular surface. Okay, the key word articular means creates a joint. So here's a facet there. Okay, this happens to be a costal facet on the vertebra, but we also have the superior and inferior articulating processes, and the flat, smooth surface is a facet. Okay, a condyle, rounded articular projection is a condyle. Here's a condyle. And then down here would be the condyles of the femur, and the epicondyles are on top of them. Okay, a ramus, arm-like bar of bone. So on the jaw there you're seeing the ramus of the mandible. Okay, anytime you have depressions and holes in bone, that's going to be so arteries, veins, and nerves can either rest in them or pass through them. They rest in depressions and they pass through holes. Okay, a meatus is a canal-like passageway like the external auditory meatus, which is that hole in the skull where your ear is. That's a meatus, a canal-like passageway. A sinus, cavity filled with bone, that's also lined with air and mucous membrane. So we have different cavities, or sinus cavities. Like you're seeing the frontal sinus there, maxillary sinus there. So your classic sinuses, which are basically about where your eyebrows are and below your eyes. When you get a so-called sinus infection, that's the area that gets inflamed. A fossa, shallow basin-like depression in bone. The iliac fossa, which is a nice groove in bone. I shouldn't use that word groove. It's a depression, this hollow, shallow depression. A really good one is in the iliac area, so the iliac fossa. Okay, a groove is a furrow. So we do have a mandibular groove here. Keep in mind, grooves, arteries, veins, and nerves like to rest in them. Fissures, narrow slit-like opening. And then foramen. So foramen, there's your hole. The most notable one is the obturator foramen, which is in the pelvis, or the foramen magnum, which is in the occiput of the skull. Okay, here's inferior orbital fissure. So you look inside, you see the fissure, a slit-like opening. That's going to allow for the passage of optic nerve and some blood vessels to come into the eyeball. Okay, epiphyseal line is the remnant of the epiphyseal growth plate, the diaphysis, the long shaft of bone, the epiphysis, the ends of bone. Okay, now these are things we've covered in the past, so know them, medullary cavity, and be able to identify what a flat bone is, a short bone, a long bone, irregular bone. Be going over some of those later on. The periosteum, the outer skin of bone. the red versus yellow marrow, so know those, and then know the difference between cancellous and compact bone. Okay, and these are things we've already gone over. Okay, down here, a suture is technically that look you get after you have stitches, sutures. When the cranial bones come together, they create a suture because it looks like someone literally took thread and stitched them, so that's where it gets the name suture. Bifid means it splits in two, so you have this Y shape, so that's bifid, or a fork in the road. Lamina and the pedicle, those are special areas on the vertebra. I'll be going over those later, and something you should have seen or will see in lab. Hiatus and canal, like your sacral hiatus and the sacral canal, so passage of nerves and blood vessels. That's what the hiatus and canal are for.